Well, good afternoon, and it's good to be with all of you again, and thanks for viewing and listening this afternoon. We're here to update Virginians on where we are with the coronavirus and what we expect to happen next. First, let's review again where we've been. Since early March, when Virginia had its first COVID case, we have urged Virginians to do everything possible to stay safe and healthy. I issued a stay-at-home order. We put restrictions on businesses and gatherings, and in May, I issued an order to wear masks in indoor public spaces. We urged physical distancing, telework, and emphasized the importance of being careful and responsible. And I am proud to say that thanks to the efforts of all of us, all of you, these strategies have worked. We have kept our cases count relatively low. We have not seen the spikes that some other states are now seeing, but we're seeing some troubling numbers and an increase in cases largely out of the Hampton Roads area. I know we all hoped that this virus would go away, but that's clearly not the case. And until we have a vaccination, it will impact everything that we plan: weddings, school openings, the November election. We are in this for the long haul. So we all need to be clear-eyed about what our health situation is and how we can continue to keep our numbers low and our people healthy. As a doctor, I believe that numbers tell a story. So I want to show you some data slides so you can see where we are right now, where we are today. As you can see, our case numbers are increasing overall statewide in this 7-day trend, and it also should be noted that we're testing more. Today, as you all saw, we reported over 17,000 PCR tests. These are the statewide numbers, but things look a little bit different when we break out the numbers on a regional basis, and I'll show you that in just a moment. In this graph, you will see that the percent positivity is inching up recently from a low of about 5.9% to now about 6.8%. And that's still a good number. We're well below the 10% positivity rate. We want to keep it that way. VDH continues to hire additional contact tracers, and we are doing an average of 10,000 tests a day statewide. Now let's look at the numbers by each of our health regions. This is very telling. You've seen this data broken out for Northern Virginia before. Northern Virginia has 2/3 of our population, but I'm pleased to see that cases there are dramatically down. The percent positivity in the northern region is 6.7%. Our southwest region is seeing a small uptick in cases. The percent positivity there is still low. It's at 4.8%. The northwest region is also holding relatively steady. The percent positivity there is 5.9%. We're seeing a small increase in cases in the central region. The percent positivity there is 6.6%. And finally, here's the eastern region. You can see that the situation here is much different. This is a large increase in cases. The eastern region's moving 7-day average of new cases was around 60 in early June. Today, that average is 346. Simply put, a large portion of the increase in cases that we're seeing in our state numbers are coming from the Tidewater region. The percent positivity here is 10.1%, and it's been rising for a number of days. There is clearly substantial community spread. A lot of that increase is driven by people socializing without wearing masks, especially young people. As a matter of fact, the increase in the age group of 20 through 29-year-olds from here compared to early June is up 250%. 250% in individuals aged 20 through 29. And this should, to all of us, and it is very concerning. So I want to reassure Virginians. We are not seeing spikes like Florida or Texas. Florida had more than 15,000 new cases in one day. We had fewer than 1,000. But we don't live in a vacuum. We border 5 other states and the District of Columbia. Hampton Roads is a big tourist hub for the East Coast. If we don't take this seriously now, we could see bigger increases across our Commonwealth. That's why we're taking action today to head this off. I've asked the local health team in Hampton Roads for their recommendations, and I'm reviewing them. But it's clear that step one is stronger enforcement of the existing regulations because, quite frankly, of the noncompliance. Our health commissioner, Dr. Norm Oliver, today is sending a letter to the health district directors reminding them of their authority to enforce face covering rules and regulations on physical distancing in restaurants and places where people gather. I'm also directing teams made up of members from the health departments, the Virginia ABC, the Department of Agriculture and Consumer Services, and other licensing agencies to conduct unannounced visits to establishments as needed. The Virginia Department of Health is deploying 100 people to ramp up enforcement. And this will happen across the state, but it will be especially focused in the Hampton Roads area. If you own a restaurant or a business and you're not following the regulations, your license will be on the line, and we will not hesitate to take action if needed. I'm also calling on businesses to step up their own enforcement. If a patron of your establishment is violating the rules, you have the ability to say no. It's just like the signs in so many store windows that say no shirt, no shoes, no service. Now it should be no shirt, no shoes, no mask, no service. Remember that you don't have to serve a patron who's not wearing a face covering. You can tell them to leave. And if they don't, they're trespassing, and you can, in turn, call the police. Third, I'm writing to the mayors of our beach communities asking for a full update on the beach access plans that they put forth in May. Those were detailed plans involving a number of sanitation and mitigation measures, and I want to be sure those mayors are following through on their promises. And I've directed the Virginia ABC to develop a plan to impose an earlier cutoff for alcohol sales at restaurants. We'll announce more details on that soon. I want to be clear. This is not the end of the actions we may take, but the beginning. I am considering other actions as needed, such as reduction in the size of gatherings. I want to make it clear that these enforcement actions are to stop the people who are clearly flouting the rules. You are being selfish, and you are hurting everyone who is doing the right thing to help us all beat this virus. I want to be clear. It's going to take everyone working together to do this. This is not political. This is about our health and well-being, and it's also about our economy. It's going to take all of us to move forward safely. Now I want to also provide an update on PPE. We continue to get shipments in, and we're distributing those to regional healthcare coalitions, local jurisdictions, assisted living facilities, state agencies, and health districts as needed. We have distributed a total of 49 shipments since yesterday. Our hospitals are not reporting unmet needs for PPE supply. Other healthcare settings, which go first to the private market to buy PPE before they turn to us are reporting that the private market is not always predictable. But overall, we feel like the supply of PPE statewide is stable. As we continue to move forward, there are many other policy decisions to be made. One of the biggest areas on everyone's mind is how and when to send our children back to school or to colleges and universities for the fall semester. I know these are not easy decisions. They're not easy choices for our parents, our families, teachers, or school administrators as they all work to balance what's best for a student's education with what's best for the health of students, teachers, faculty, staff, and families. We all want to be comfortable sending their children back to school, and we also want teachers and support staff to feel safe going back to work. Our Department of Education has set out guidelines, and local school boards will make the final decisions. In this case, one size does not fit all. Physical distancing will be a critical component, and a school's ability to accommodate that may vary in different regions of our state. In much of rural Virginia, where schools have fewer students, this may mean 4 or 5 days a week. It may mean something different in other settings. But local school boards will decide. Some have already acted, and many others will be finalizing their plans in the next couple of weeks. Similarly, SCHEV is reviewing reopening plans from our colleges and universities. Again, one size does not fit all, and these are complicated and difficult decisions to make. Schools from K through 12 through higher education must be aware of the health data in their locality and be prepared to shift their plans as needed. Our increasing and improving ability to test, trace, and isolate cases will be an important component as we move forward.